Thank you for tuning in to this edition of Our Ventura. I'm your host, Joshua Lane. Our topic today is homeopathy. Our guest is Raphaele Cohen-Bacry, a registered pharmacist who works for the important homeopathic company called Boron. Raphaele, welcome to the show.
Hi, Josh. Thank you for having me.
My pleasure. For our guests, what is homeopathy?
Well, homeopathy is just a form of medicine, and I would say it's one of the safest forms of medicine. And the reason why I say that is because it has no side effects and no interaction. So you don't have to worry about being drowsy after you take a medicine or nauseous. It's very easy to recommend and to use, and it's safe. It is safe in kids and adults and of course elderly. So it's
And what is your academic background?
I'm a pharmacist. I was trained in France at a university in Paris. And then for approximately 15 years, I worked in pharmacies, dealing with patients, giving a lot of advice. That's a big part of our job over there. Mm-hmm. And of course, recommending a lot of homeopathic medicines.
Sure.
Because they're so safe and easy to recommend. So it was a great tool for us.
And what is the background of homeopathy? When was it discovered?
Actually, a lot of people get a little bit confused. They think it's part of Eastern medicine when actually it was created in Europe. So it is east of the US, but it's considered Western Europe, Western medicines. And it's not new. It's not something that just came up. It was created more than 2 centuries ago in Germany. And I'm sure you heard of Dr. Hahnemann, who was a brilliant physician. And he was disappointed with the way medicine was practiced at this time. It was very often harmful to the patient. The treatments were really aggressive, and a lot of patients would die because of the treatment more than because of the disease itself. So he was looking for something that was more in tune with the patient, and he did a lot of research, and that's how he developed that system that he called homeopathy.
Actually, in homeopathy, the medicines are completely non-toxic, correct?
Yes, because the basis of homeopathy is using highly diluted substances. And by using those diluted substances, you can relieve symptoms that those substances would create when used at full strength. Let's take an example,
yes,
because I know it's a little bit confusing, but it's a pretty smart idea. Let's say, for example, you drink coffee a little bit too late in the afternoon.
Yes.
You know what happens to most of us. So when you want to go to sleep, you cannot fall asleep because you're very alert. It's not necessarily anxiety or stress, it's just that your mind is running and you have a lot of ideas. It can be over something you're going to buy the next day, so you're just very awakened.
Right.
So if you take coffea cruda, which is a dilution of the coffee bean,
yes,
and it's the homeopathic way, obviously, you're going to go to sleep and have a better quality sleep. So that's a little bit how it works. Another example that's very easy to understand too. You get stung by a bee.
Yes.
You see the edema. It's pinkish, it's hot, it's itchy, painful. And if you apply cold water, for example, you're going to relieve those symptoms.
Right.
If you have a patient that presents similar symptoms, and it's not necessarily a bee sting, it could be the beginning of a cold sore. You know how it starts with a little edema, very itchy, or a sore throat also. Some kids like to drink cold or eat ice cream and they feel better.
Yes.
That's the perfect symptoms to give Apis mellifica, which is a dilution made from the honeybee.
Could you repeat that once again?
Apis mellifica. It's just the Latin name for honeybee, actually.
Oh, really? Okay.
And if you take that, and you take it every 15 minutes, you're going to relieve the pain and the edema. You can actually see it really go down, and it's very spectacular for cold sore.
And also, let me just mention this. As far as I understand it, in the United States, you're allowed to make claims for homeopathic preparations. You can say what they do because they are regulated in the United States as drugs.
That's right. Such an important point, and it's not new. It has been so since 1938,
right.
And that's why I always say homeopathic medicines, because we're not talking about herbs supplements, vitamins. It's a different category. We're in the medicines category. Although we use plants obviously and animals and minerals, but this is regulated by the FDA, meaning that FDA regulates the manufacturing process. Every step has to be really controlled and very seriously looked upon. The labeling is also regulated by the FDA. The distribution is regulated.
Right.
And there's a label. You should always read the label, but it tells you who can take the medicine, what age, and when to consult with your physician if needed.
Now, the company itself, Boron, that you work as an educator for, how long has Boron been around?
Probably around 80 years. It's a French company. It's still based in France, but we distribute, I think, in 60 countries. So, and we do a lot of education. It's part of our mission because we want to educate people about it. As I told you, I worked as a pharmacist in Paris, and I used homeopathy with so many people. And I want to share that experience now with doctors, because I think those medicines need to be known and used more and more because they're so safe and effective.
I do know that in the Los Angeles, Malibu area, many people use Arnica montana. Their physicians recommend it when they're going to be doing elective surgery. Why is that popular?
Well, it's an old medicine also, and it was used for trauma, many years ago, and now under the homeopathic form. Do you want me to show?
Show me, yeah.
So that's the traditional form of homeopathy. Those are pellets, and you usually take 5. You don't need to touch them, but just so you can see, it's just little.
5 little, little pellets.
Five of them under your tongue, so it's sublingual. And what it does, it works on it prepares, if you take it before the surgery, it protects the capillaries. So you're going to get less bruises, less swelling, and you also have to take it afterwards, also to minimize the side effects of the surgery. You could actually take it for any kind of surgery, but we're very successful with the plastic surgeons, especially the face surgeons, because of course you want to get rid of those.
Right, those lines.
And it also comes in a gel.
And the gel is
cream.
also used by athletes. Is that true?
Again, because of the action of on the trauma, the inflammation, and again, no side effects, no interaction, no doping effects. So athletes actually like Arnica, and they like also all our other medicines for that reason.
What about medicines for colds? Obviously, that's very important.
The one, maybe my favorite, I would say, is, I'm sure you've seen that somewhere before, the oscillococcinum.
Oscillococcinum. So is that that's an important product worldwide?
Yes, yeah. And for us, it's our number 1. And the reason why I really like it, again, because imagine you're in Paris, you have all those tourists.
Yeah, lots of tourists
coming to have a good time, and they come to the pharmacy and they feel they're getting sick, and sometimes you can't even really talk to them really well because they don't understand, and you don't know what other medicine they might be taking, so you're afraid of interaction.
Sure.
So oscillococcinum was a great tool for that reason, because it won't interact with anything, and they won't feel drowsy the next day, so they can still drive their car, go to the restaurants and just enjoy their staying in Paris. So that's why I recommend it a lot. And it's sublingual again, so you empty the whole little vial under your tongue, so when you're on the go, you don't even need water. So it's a great...
And this will do what? If a person has a cold, this will do what for that person?
This is more, I'm sorry, this is more for the flu.
For flu. For
flu,
okay.
And symptoms that are very similar to flu, but that we call flu-like symptoms.
Such as,
the body aches, the fever, the headaches, the sore throat, everything you feel before you get the flu, or when you actually have it.
Okay, and then this will do what for that in a person?
This will really relieve the symptoms really quick, so you're going to be able to get back on your feet much quicker. If you take it really early, that's when you should take it. Right. Actually, it works better. You can nib it in the bud and just, you avoid the flu. A great also
So if a person thinks, I am sick, I have the flu.
Oh, I might have the flu. I'm not even sure it's the flu.
That's right. And I take the oscillococcinum.
1 dose.
Pronounce that once again for me.
Oscillococcinum.
Oscillococcinum, okay. Then theoretically, you can just avoid the flu.
If you take it really early, you can avoid it with 1 or 2 doses. It's 1 dose every 6 hours. Sometimes, because you didn't have it, so you wait a few hours, it's going to take maybe 2 days to get better.
And so therefore, instead of being sick for a week or two, you're just kind of feel a little diminished for 3 or 4 days or
Yes,
something?
and you can still work, you can still take care of your kids, and my advice is to have a box at home, because when you're sick, you don't want to have to go outside in the cold and try to get a box. That's what I have. I have one in my car and one at home.
Huh?
And you can give it to kids age 2 and above, so it's good for the whole family.
What else have you got? What else?
There's another one. Oh, I also, if I just can add,
Yes.
because it works on flu-like symptoms, so even if you have the flu, you get the flu vaccine, well, you know, it doesn't work 100%. So even if
The
you
flu
get
vaccine doesn't.
Yes.
Yeah, it works. What, 15% or something? It doesn't
Or
really work
maybe
terribly
more,
well.
Maybe 70%.
Oh, it does. Mm-hmm.
But sometimes you get something that's similar to the flu,
Right.
but it's not the actual flu virus.
Right.
So the vaccine is not going to protect you. So that's when you can take Oscillo.
Now, let's just talk about France for a second. The French government recognizes homeopathy, and does their National Health Service pay for it?
Yes, yeah, percentage. When I was there, it was 60%. I think now it's a little bit lower, but it's a good reimbursement. Yes, it's totally, and it's only available in pharmacies in France, and every single pharmacy has it.
So the French government sees this
It's part
as
of
as homeopathy as a legitimate healing tool.
Same thing. We don't make any difference. Very often you can see a patient coming with a prescription. It has, you know, for example, antibiotics and homeopathic medicines. We don't really make a difference. For us, it's medicine.
And this is widely used in France?
Oh, yeah. Yeah, well, I heard
It's
lately.
mainstream?
Yes, I heard that 60% of the population just use homeopathy.
Wow.
So yeah, it's very common. I was told about homeopathy in pharmacy school.
Huh?
So it's something that's why I was surprised when I came here, because it was 10 years ago and a lot of people didn't know about it, or were getting confused between herbs and vitamins. It was a whole blurred. So now it's changing.
What about, it's my bit of your expertise, but what about Germany? Is Germany also strong?
Germany it's very strong, because you know that's where it all started. So Germany is also very big on homeopathy. England, Italy, the whole Europe is
and
very.
So the German health service pays this?
That I don't. It's
Okay,
not
so-
my.
so-
Yeah, I assume so, but I'm not sure.
Okay, good. But at least you're definitive on France. All right.
Oh, yeah.
And what do we have? These are
This
cough
is,
medicines?
Yeah, it's a great cough syrup that I like also, because you know sometimes how difficult it is to know if it's a dry cough or wet non-productive or wet productive. So you don't always know which cough cough syrup you have to.
That is, yes, I understand that for sure.
With this one, it's very convenient because it's a combination of, I believe, 9 different homeopathic medicines, and each one target a different type of cough. So it's going to work on pretty much every cough you can have. It's honey based, so you add also the benefit of the honey, which is very good also for cough, and it tastes really good. So you won't have to fight with your kids. So they're gonna. It's actually true for all our medicine. They taste usually very good. It's just natural, a little bit sweet.
And I also do notice that the remedies in this country have little labels that tell you what the symptoms are, and it's very specific.
You mean on the
Yes, all the things they do, and they tell you some things are good for anxiety.
Yes.
It's terribly specific, and I always find that very interesting. And it actually does seem to work.
Well, it does. It has 200 years of reliability and efficiency. So we know it does work, and it's very interesting to see how quick and on how many conditions you can use it. Acute conditions respond really well, like allergies, cold and flu, cough, teething is also wonderful. But also chronic conditions, you can treat it with homeopathy really well. I would recommend to see a physician who has been trained in homeopathy, though, because you need to know how to interview to go to the.
Raphaele, this has been very interesting. And unfortunately, our time is up, but I'd like to thank you for coming by.
Thank you so much.
And do you appear for Boron regularly around Southern California?
Yeah, the LA area is my territory, and we're trying to do more and more education for patients. Also, if they're interested, they can go on our website,
The Boron website.
Yeah, BoronUSA.com, and there's a medicine finder, so you just key in your symptoms and you can find, which one you should use.
Okay, very good. Thank you for tuning in to this edition of Our Ventura. I'm your host, Joshua Lane. Thanks for your time.